So for me, I do a lot of hormone optimization. And so I'll get people that'll come to me and say, oh, I'm tired, and oh, I've got this symptom or that symptom, relating it to low testosterone, right? And they so quickly want to jump on TRT. And so I'm going to compare that to with you. I'm assuming that a lot of people want to jump on a medication. But what I try to do and what I can see that you try to do is we try to find the root cause and fix that first as opposed to just medicating. So for me, you may have low testosterone for sure. I may pull your blood panel and see that it's there, but I will go in and say, oh, you've got high SHBG, so that's bounding up your free testosterone, or oh, you have a liver problem, or oh, this and that's causing this. Let's fix this first and then see the result as opposed to just here's TRT forever. So is that kind of similar to what you do is let's dig in here, find the cause, treat that, see if it fixes the issue. And then if it doesn't, then we progress into something a little bit deeper.
Yeah, exactly. I mean, if you can identify the root cause, whatever the root cause is, sometimes the root cause of a mental health problem is a thyroid problem, right? This is a very common issue where, people have thyroid dysregulation. It's very common. And if your thyroid is messed up for whatever reason, that impacts everything about your nervous system functioning and your mood and your metabolism and everything. Your entire body is regulated by your thyroid. So one of the examples that we do in mental health is before we even think about treating you with a mental health, as if you have a mental illness, we run a series of labs and we look at, okay, well, is there anything that could be an obvious physical sign of something wrong with your body that would be why you're coming to me? Right. And if you have thyroid issues, that's what we treat first. Cause that's like an easy fix. You may never need to see a therapist if you can fix your thyroid and get everything straightened out. Right. But then if we do the full medical workup and we realize, oh, you're actually physically, medically healthy. You don't have any issues going on that would result in a mental health problem. Then we start to look at, okay, well, what else could be causing the mental health problem? And it's basically like a root cause analysis, so you're like really diving into, what is at the core of what's happening medically, then psychologically, then emotionally, and then really and then with stress as a core theme, try to figure out, what's at the core, and then how do we address that first? And that helps us kind of steer the direction of treatment planning for people. And that's what all psychiatrists should be doing. Many of them do, but there are some.
Okay. Yeah. And see, I'm leading. So where I'm going is I want to stress. So I always stress to people, look, I'm not the only one in the world that does this, but find yourself, if you have a testosterone problem, find yourself a professional endocrinologist that will go step by step and do all of this and figure it out. And so I'm going to revert that to you. Don't just depend on a regular doctor who's just going to throw you on, chances are, I'm not saying they're all this way, but just going to throw you on medication and move you on your way. Find someone like Dr. Dave that will take you step by step and really dig in and find the problem. That way you could actually avoid creating yourself further problem by getting on a medication that you don't need, which we want to prevent, right?
Yeah, exactly. Because all medications have side effects. All surgery, as good as the outcomes might sound, have potential risk. And there's no medication or surgical based treatment that doesn't come with potential risk. And that risk is often not worth taking. So if you can work with somebody who understands, a diagnostic framework, it doesn't mean you're going to leave with the diagnosis. It means you want somebody who's going to put their detective hat on. And, rather than going straight with a prescription pad, they're going to talk to you enough and gather enough information from you during the history and physical exam process to figure out, okay, what is actually going on here before I start handing you treatments, right? That's really our core of medicine that, we're all taught throughout our medical doctor training and that, most doctors have. The problem is in modern society, medical treatment has been commoditized as a business. And so doctors don't get paid enough to do what they do. And so many of them, and insurance companies are often trying to tell doctors what to do. And so, the saying, when you're a hammer, everything looks like a nail, right? That's not the case. Just because you have a hammer doesn't mean everything is actually a nail. It means that certain things are nails that you use your hammer on, and certain things are not nails and you need another tool. And so
That's right.
doctors have lots of tools. You know, we have like the benefit of medical training is that we have all the tools available to us. We just need to know what's going on. And so, you know, if we take enough time and clients have enough patience with the process of us getting to know you to figure out what's going on, which often is on both sides, it's a rush, right? There's not enough time to figure that out, or it seems like there's not enough time to figure that out. If we rush through the diagnostic process, the quickest solution for from a doctor's perspective is, well, let me take out my prescription pad, right? And that's not the best option in most cases. Usually there's, you know, anywhere from like 3 to 10 different things you can do that don't require medication or surgery that can start to make a dent before we start moving in that direction to riskier options.
Yeah. And that's where I always try to bring that point to light. Look, every single doctor has a purpose and a reason, but you have to remember that, like, when you go to a general practitioner doctor, they come and talk to you 5-10 minutes and that's it. They can't really get a feel for what's going on or really truly know. And they give you like a basic blood panel and move on and write you whatever you need to get you out and move on to the next. And so that's why it's so important, especially as you get more severe or more based on a certain condition, that you find a real professional that really just focuses on that actually delves deep into the process.